happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
Hi, good morning, everyone. Good morning from Rhoda. So I came at the right time. My change management capstone project is title is Bridging the Gap of Pediatric Care on Rhoda. On the island of Rhoda, population is about 1,600 people. A small community with a very diverse population, and we have, I guess, maybe build upon community's culture and the differences, and healthcare is also one of the things that we are building on. So the reason why I chose this project is because as a former school administrator, or I work for a public school system, and now healthcare, my heart is on children. And I have observed and noticed that pediatric care, such as well child checks on Rhoda, is also something that we need to focus on and look into. As I have noticed that there are most children that don't come in for the annual well child checks. Next slide. So the health equity challenge is the gap in well child visits among children living on Rhoda. I put a picture there of we call it the yellow card, where on one side there's the well child visit schedule, and the other side is the immunization schedule. Um, the most important, I guess, maybe here in Rhoda for parents is like the first years of their vaccination schedule, where they're very prompt. They come in and they really check on their children's health. And then as soon as they get into, like, after their school age, they are more concerned about getting the school clearance cards, which is like an annual requirement for getting into school. But then they forget the well child visits are also as important as immunization schedule and their school clearance cards. So the health equity challenge again is it's the preventative pediatric care in Rhoda is underutilized and used primarily by families for vaccinations or school clearances, and the lack of routine well child visits jeopardizes children for undiagnosed health issues and delayed developmental screenings. So that is more of like the concern, or like, something that I wanted to look into. So in establishing urgency, the need for action is made clear by looking at the data that we have. So this year, we have been introduced to the 2023 NCD Adult Hybrid Survey results, showing that 61.1% of Rhoda's adults had no annual exam. So I kind of based that information or that data because it's really significant as it also relates to adult care, but reflects a larger issue of preventive healthcare being neglected on the island. So we can see that there's, out of the three islands, Saipan, Tinian, and Rhoda, Rhoda has the largest or the most that have not gone into their well child or no, for their annual adult physical. So the need to establish data on current pediatric visits and the need to modify community culture, increase access to care, and integrate well child visits into school health clearances. Next slide. So for the team building portion of this project, I looked at the community composition, and because we are a small island, we know each other, and we actually have implemented and have done projects and events and activities with other agencies and departments on the island. I've listed exact specific people. which includes like within CHCC, Commonwealth Healthcare Corporation. So we have our department chair, which is, more of like the head and the person that I can get expert information. We have our physician assistant who is also here on the island on a contract. So we have, turnovers of providers in the clinic, and it's not constant, but we hope to get this physician assistant to be a part of the project. We also have an immunization program coordinator within our staff, our interim nurse clinic manager, and of course, our clinical coordinator, who is part of our clinical team to make sure that we look into the data and making sure that we have our um, children come in for their well child visits. We have our patient access registrar, in which most of the time we also consider some of our kids coming in, and the most parents would just kind of like pass through patient registration, thinking that the vaccinations are more important than the school clearance cards, and never mind the well child visits. So that's why the patient access registrar is also an important person in this project. From the community and our agencies, we have our program staff from the Rhoda Child Care Development Fund. And I kind of looked at the age 0 to 17. So we have families that are caregivers that are part of the early childhood ages. So that's the Rhoda Child Care Development Fund. And then looking at moving on to the Rhoda Head Start program. So that is also the some of our kids that are required to come in and get their vaccination cards and school clearance. So Rhoda Head Start program, a person was considered. We have also identified school principals, and we only have one public school system in Rhoda, and one elementary school, and one combined junior and senior high school. So principals were identified in this team for the implementation. Next slide. So the vision and strategy, oh, that was fast. So I wanted to, I put in a statement that is actually geared towards looking at our data, our baseline data. So the aim statement is to establish a baseline data towards 0 to 17-year-old children receiving well child checks at Rhoda Health Center by using the population level data for Rhoda's children, and aim to increase the number of children receiving well child check services by 5%. So the scope is to initiate, this pilot will just initiate on Rhoda alone, and it will involve the Rhoda Health Center, the schools, like I mentioned, early childhood programs, and the community. The objectives are to develop and implement a policy for connecting well child visits to school clearance cards, and making sure that it's as important as getting those blue cards for school entry, and also it's an annual thing. Next slide. So the communication plan on Rhoda, this is a small community again. We try to connect with people through flyers, through social media, through messaging. And of course, we won't forget those that are out in the outskirts. And those information, of course, will come also and will be assisted by our mayor's office and our government agencies on the island of Rhoda. So our target audience is actually our parents and caregivers of children 0 to 17 years on Rhoda. Our secondary audience are school administrators, teachers, childcare providers, and community leaders, such as our mayor's office, our government agencies that are highly involved on the island of Rhoda. And tertiary audience is CNMI and CHCC policymakers and leadership for future growth. Next slide. So the overall goals and implementation, I actually looked at the whole project and how this will be carried through on Rhoda. I kind of looked at two goals. Am I up or Okay, yeah. So the rate of compliance with annual well child visits in children 0 to 17, the goal is to sustain and achieve a 75% completion rate for 0 to 17-year-old well child visits at RHC by August 2027. I extended the year so that at least it will give us time to work with the team and to make sure that we also have the information, the data that's needed to start as the baseline to start and move on with this implementation. This metric will be incorporated into the CHCC population health activities and tracked as one of the public health program outcome objectives. And the collaboration, we will work with RT staff to standardize the collection of data and conduct yearly performance reviews. The other goal is the school clearance compliance with well child requirement. The goal is that 100% of school clearance cards issued at RHC include verification of a child check having been completed. Update the strategy is to update the school health clearance process within CHCC's administrative policies to include a mandatory well child check. And I know that mandatory word is kind of harsh, and we've had some issues with our parents in the past, but I think it's for the best and the better of our children on Rhoda. Collaboration is work with CHCC's Public Health Director, our Immunization Program Manager, and CNMI PSS leadership to update clearance documents and approval processes. So these two goals will be introduced and also will be our goals to move this project further. And that'll be the end of my presentation. Thank you.